have nowhere to run to, and we have to accept the reality that is, I mean, the era now is technology, and then we have to accept it, and then our older people should please kindly bear with us. Things have
Yeah.
changed; they have to change with time as well. So,
Yeah.
um, that will now take me to this particular question now, which is more about, I mean, the nursing. I mean, we are talking about nursing now, and then we want to be more specific with Nigerian nursing system. Now, how can this virtual learning now be inculcated into nursing training curriculum in Nigeria specifically? Because I know very well that at a point in time, some years back, I I happened to see some memo or some information coming out from Nursing Council that some education, some learning that some training that were done online were not accredited or were not accepted. And then I think that was this going forward, this moving back, and it was not really, I mean, specific or accepted as that, and I mean, it generates a lot of controversy. So, but with what we have now and with the COVID, almost virtually almost all the countries around the world at a particular point, I mean, at a particular point in time, shut down the economy. Nothing was working in Europe, in US, in Asia, in Africa. Some countries have to shut down, and it means that everything was shut down, including the schools, the I mean, everything. So what will now happen to those, I mean, the students that were at home? So now with this reality now, I mean, what advice do you have to nursing academia community in Nigeria to accept and assimilate this virtual or e-learning into nursing curriculum, and as well as Nursing Council of Nigeria?
Yeah, thank you for that question, because that has been something that, when I find myself in this system, this is something I've been thinking about that. So what will be happening in Nigeria now? You know, I want to say that the leaders in nursing in Nigeria, especially in the academic community, we need to sit down and really take an honest consideration on the breed of young people that are entering into nursing now. If we are really current with what is going on in the world, the current young people now that we offer admission or that are currently in nursing program now, majority of them globally, they are the Generation Z. They call them Gen Z. These are the people that are born from like 1995 up till early 2000, 2000 and up to 2011, 2012. Those are the ones born around that time. And these are the young people who were born into a technology-driven society. Everything they played with, everything they were raised with always been computer, has always been technology. And that is why when we have them as children at home, there are things that you're like, even as parents, you just think like, when I was your age, I was not thinking like this. When I was your age, I don't do things like this. Yes, because in our own time, there was nothing like that. But now that is and those are the breed of young people we have in nursing. And I want to strongly advocate that there is that need for us, especially in nursing education in Nigeria, to review the curriculum in order to consider and accommodate these young people. Otherwise, we'll discover that the lecturers, the educators, they are running their things at one end, and the learners that are supposed to be listening to them are, they are just running at parallel lines, because they have different ideas, they have different mentality, and the academic community, they are not ready to really look at the characteristics of this group of young people. When I was reading about this group of young people, of course, I also have them as my children. So I know that this is really true. You see, because that this group of young people, they are more interested in anything that is related to technology. They are not interested in reading an article or a textbook. That's not the generation of the young people that we are talking about. They don't want to read any textbook. They have a very short attention span. These are the young people, these young people, they are not the group of young people that you can plan a lecture of 2 hours, non-stop. You keep talking as a teacher. The thing is, when you plan 2 hours lecture for a student, no video, no activity, nothing at all, at the end of the day, the students will only listen to you for 20 minutes, no matter how long the lecture. The remaining time, you have only wasted it as an educator. I mean, that is a product of a research. So there is that need to put, to really consider these young people. And I am really passionate about that because there are so many health challenges that are involved. For example, I'll just briefly talk about their characteristics. They are high consumers of technology and cravers of the digital world. They are pragmatic in the way they approach things. It's all about doing it. They employ a lot of experiential learning. They are underdeveloped in terms of their social and emotional skills or relationship skills. They are cautious because these young people, they are born into the time when the world is facing a lot of uncertainty regarding the social system, the political system, economic system, war everywhere. So they are born into uncertainty. So these young people are cautious and they are concerned with their emotional, physical, and financial safety. They are individualistic. They increase risk. They have an increased risk for isolation, anxiety, insecurity, and depression. And that's why when you have them close to you, you see them, once they have their tablet or their phone or whatever, they're always in their room. They may not come out from morning till night. If you don't make efforts to control it, they won't. Now imagine them in our institution. And that is why, because of the lockdown and this COVID-19, you have a lot of them, having depression and even attempting suicide or even taking their own lives as a result of this. Then there is lack of attention span. They desire convenience and immediacy. So how can we use all these and use it to plan their curriculum, especially nursing education, in such a way that we will bring out the best in them? They are open-minded, they are diverse, they are comfortable with diversity, they love diversity. So I would say that there is a need, strong need, to actually review nursing education curriculum or curricula all over the world and actually include e-learning, virtual learning. We need to embrace virtual learning. We need to promote the use of e-learning, virtual simulations, virtual preceptors among the faculty, among the students. Gone are the days when we say, this is how it used to be. Things cannot continue that way. We need to change. This is a time when we really need to change. Nurse educators, we need to explore fresh approaches to teaching learning in nursing. And then we need to carry out more studies on use of virtual learning in nursing education. I believe the nursing institution in Nigeria, nursing educational institutions, they have their proprietors and owners. The nurse educators, they should also advocate for the need to actually invest in, of course, everybody knows now that is the way the world is going. So there is also the need to also do that in nursing. That is very important. And of course, I will still talk about what individual, educators need to do in their classes. I'm just talking generally now. They need to use various, varied methods to teach and access learning. It shouldn't just be lecture. You can use in a class of 2 hours, that spans 2 hours, you can use 4 or 5 different teaching methods. What this young generation, what they don't want is monotony. They don't want routine. They don't want to be doing the same thing repeatedly. They get bored. So you need to bring in activity like talking to the person, process and information, talk to the person beside you. Now, the two of you, as you are doing that, you are also encouraging them to think critically, which is very important in nursing. Okay, discuss among yourself, tell the person why you have decided to do it this way, and now do you want to share it with the class? bring in different group activities and different things that they can do that will just make them active and be creative as they are learning. And then, yeah, I think that's that. And of course, the last thing there is nursing academia. They need to advise the Nursing and Midwifery Council of Nigeria about the need to inculcate virtual learning into nursing education, because I know the curriculum the curricula that are used in the educational institution, they are from the Nursing and Midwifery Council. So if they get that directive from Nursing and Midwifery Council, people often comply easily with it. So there is that need for Nursing and Midwifery Council to also see it as something that is urgently needed in nursing education in Nigeria. Now let me talk briefly about individual educator, nurse educator, and their students. In a class, you need to consider innovative approaches in teaching. It doesn't just have to be you doing the talking all the time. Now, studies have actually made us to find out that in class, even though you are the teacher, you have come to teach your students, but actually you co-learn. As you are teaching that student, you are imparting knowledge, but you're also learning from them, because there are some things they will tell you that you discover that, oh, really, I never thought about it, or I never looked at it from that perspective. So as a student is learning, the teacher is also learning, using hybrid and blended course approach. They adopt interactive e-textbook where possible. This is not the generation that wants to really read 200 pages textbook. Even 100 pages is too much for them. But give them, but if it is online, where they can type, they can write, they can critically, reflect on what they flow along. Employ experiential learning. Offer convenient faculty hours or electronic office hours. I know that Nigerian system lecturers are like, no, you can't contact me. No, I can't give you my phone number. Gone are those days. You and the students, you are in a relationship. You need to define how you want that relationship to be. And part of it is that you are a role model to that student. That student is learning from you, and the student must have access to you to some extent. You now have to define it. You have to let the student know, oh, this is the time we can meet to interact. This is the time we can meet virtually to interact. This is my electronic office hour. Students should have access to it. They help students engage in dialogical conversation. Like we said, they are so much involved with computer and all the stuff. How can they engage in dialogue and not just computer? These are the skills that we need to groom in them, even while teaching. Be flexible in the nursing curriculum and the coursework. It doesn't have, for example, in the assessment, it doesn't have to be every student must answer all the questions during assessment. Give them variety, maybe one or two options. Okay, critically analyze these using either of A, B, C. Give them options. And by the time they respond, you'll be surprised at the different ways and the different ways they have processed what you never even thought about. Instead of allowing them to all think towards the same, just one direction. Regularly switch between teaching learning modalities during a class revision. Regularly switch. For example, use active teaching learning strategies. That is the way the world is going now. Active learning strategies. I remember I was in a class last week. I was, with some students using the active learning strategy. And the students earlier, one student already told me that, oh, you know what? That was their first experience clinically. So he said, going with the nurses, doing stuff, I felt like I'm just like a zombie, like a moron that really doesn't know anything. I'm just following her about, do this, I'm doing it, do that. And I asked, okay, so what learning opportunity, what learning experience did you pick from there? I said, is there any learning experience? Then yes. Then I started asking probing questions. And at the end of the day, it was like, oh, so I really learned. I never realized it. Then the following week, he now told me that he took part in the handing and taking over, and he was so happy. In fact, the way he was expressing, he said, I was so proud of myself. I felt so confident walking into the patient's room because I already knew what happened at night, with them. So I was able to plan my care, and I was able to give. This is how we can encourage students to learn. It's not just do it this way, do it this way. If you don't do it this way, you'll be punished. If you don't do it, no. This generation, they don't want to. It doesn't work with them. That's just it. Give short, succinct, and prompt feedback on assessment. It's very important. When we give them assessment and we mark their exam or whatever examinations, we don't just give them 50 over 70, and that is it. It is our responsibility to let the students know, why did I score you 5 here? You scored 5 here because you did this well. This one you did not really, this one you would have improved this way, but we shouldn't just leave it as if, yes, I'm the Lord and Master, and whatever I do, that is the best. And that may also be a reason why some of the educators are struggling with virtual learning, because virtual learning does not give room for that. If you assess, you have to provide feedback, and you have to provide feedback in such a way. Actually, nowadays we call it feedback and feed forward. Because if you say feedback, it's done already. But you want to give them that information in such a way that it will improve their subsequent performances. So you give feedback and feed forward, which is also very important.
Thank you very much. I actually did not want to cut you in because I see that there were cogent information that we were passing out, and I realized that I don't know. If time permits us, or if you allow us to, to invite you, I still have to invite you again, because there is this one particular topic that you raised, one point that I think I want us to iron out very well, and I want to use that too for my own personal experience too. That that is about student-teacher relationship. I want us to talk about that. I think in Nigerian system, with those of us that went through all this school of nursing training, I think it is still fair in the university, but in school of nursing, it is quite, it's a different ball game. And for those of us that also attended missionary school of nursing, it is another story entirely when you are talking of student-teacher relationship. So if you don't mind, I will still have to invite you to come up on the show, and we are going to talk about this particular aspect, because you said a lot about that, and there are so many things that were actually wrong. When I also had the opportunity to become a sorry about that. And when I had the opportunity of becoming a a nurse educator, I think some of these things that I had experience with, I tried as much as possible to I say no, things should not be in that way. So we still have to invite you if you actually will accept our invitation for that again. Before we close the show, there's this particular question too. Now, how can Nursing and Midwifery Council of Nigeria accept the fact that things have changed, most especially with technology, and what advice do you have to Nursing and Midwifery Council of Nigeria to accept this fact? Because I want to share my own personal experience too. For instance, at least everything we have to talk about in nursing, there is no way we are not going to talk about Nursing and Midwifery Council of Nigeria, because the act that set up Nursing and Midwifery Council of Nigeria stipulated it and said it clearly that the NMCN is the only recognized body that regulates nursing education and practices in Nigeria, meaning that when we are talking about nursing education in Nigeria, we still have to talk of Nursing Council. When we are talking about nursing practices in Nigeria, we still have to talk about Nursing Council. And that is why, so I'm saying this so that my viewers will understand. Some of you will have to understand the fact that Nursing and Midwifery Council of Nigeria will have to come into this topic, because that is the only regulatory body that regulates every activities, both education, academic, and nursing practices. And that is why they have this particular right to say this particular school does not meet up with the criteria, so we cannot give them the license to, I mean, they don't have the quota, things like that. Now, I want to use this scenario. I attended a continuing education program. It was done online, completely online, everything virtual, everything e-learning. The person in charge used everything just as you said, because at the end of the day we had a questionnaire to analyze how the person really was he able to use the tool, how were the, I mean, so for instance, something like the, I mean, using the whiteboard, using the charts, and then using, I mean, the PowerPoint and things like that. How was the information passed? So we did this continuing education online, and it was very, very perfect. So I see no reason why Nursing and Midwifery Council of Nigeria should not adopt that system. When somebody is in Zamfara or is in Bauchi, we have to travel. Maybe he needed this particular thing to renew his license. I have to travel to Kano or travel to Katsina, all because he or she wants to renew the license and putting the life in danger. Why not do it online and have everything and accredit it and pay the sum of money that should be paid and have the CEU? So I'm asking this question so that what advice do you think you have for Nursing and Midwifery Council of Nigeria to adopt this e-learning?
Thank you. I think this is really an important part of this interview, because the Nursing and Midwifery Council of Nigeria, they are really doing a great work. I mean, Nigeria is a very large country. It's a very, very large country. You know, it's a big country. So you can imagine just one body managing all the nurses and the nursing programs and practices in the whole country. So it's really a big work for them. But I will still want to say that they need to invest more into the future of nursing in Nigeria. They need to look at different options. For example, you know I got into nursing profession meeting the problem like this, and I thought it would have improved. Now it's even becoming kind of worse. I don't know, but what has always been coming to my mind is, why can't we have zones in Nigeria? Why can't we have different, it's like there are different zones in Nigeria operating differently regarding nursing, nursing practices and education. So why can't nursing and midwifery just walk along that side and make things even more easy for nurses in Nigeria? Specifically, there is a need to move programs and trainings online. And for Nursing and Midwifery Council as a body, it actually eases a lot of burden from them. It cuts off, I know many people would not be happy with what I'm saying, but the truth is, on the long run, it pays Nursing and Midwifery Council. Just like you said, and the scenario you painted, they can get students even from outside Nigeria that will still pay money into the account of Nursing and Midwifery Council and still go through their continuing education program. And it would be delivered. It could be delivered either as a live virtual training or a pre-recorded training delivered to the participants. But I know that would actually cut off some middlemen. It will cut off some people. Sorry, I don't know how to mince words, but that's my understanding of what it is going to cut off some people, kind of. But we have to move beyond individuals. We have to look at the future of our profession, of our beloved nursing profession. If we want our profession, especially in Nigeria, if we want the practice and education to rate at par with countries, the Western world, we just need to do things right and get it right. Moving trainings and courses online would actually take up capital to start with, especially if they have not been doing it. But on the long run, they'll find out that it is really cheap. It's cheaper for them, because at the end of the day, every participant that will be coming, that will attend, would not have to travel, but they will just use their devices. They will be the one responsible for getting their own, making sure they have internet, making sure they have electricity, whichever way they will have to, they just have to do it on their own. And that eases the burden of Nursing and Midwifery Council. Then there is a need to encourage nurse educators. Of course, Nursing Council, like I said earlier, because we have nursing curriculum from Nursing Council, we have midwifery curriculum from Nursing Council, and all the other specialties. They have to encourage nurse educators to include virtual learning into their teaching. And I know Nursing Council of Nigeria, they are very good at enforcing all these things when they want to do it. They are very good at it. They need to encourage e-learning modules that are related to nursing and direct patient care to ensure optimization of benefits. In the Western world, there are different platforms where you have modules that are nursing related, that once Nursing and Midwifery Council accredits or acknowledges that, oh, this is one of the ones that we have actually looked through, and we think they're okay for our nurses. If you take these courses, if you take this number of courses, this is the number of credits that you will earn, regarding your continuing education. So it doesn't always have to be MP, PCP, or what was that? Mandatory professional
continuous.
I can't read.
Continuous program.
Mandatory professional program. It doesn't. There are other ways that they can always go about this. And I know I saw one on the platform sometimes, maybe last year. I know there is one that Nursing and Midwifery Council, but I don't know how many nurses are really keen into that kind of opportunity. It's an e-learning model. And I think these are things that they should make people, let them do it. By the time they see that the MPCD program has been moved online and other modules are online, every nurse will be forced to go for personal training on this e-learning or virtual learning. And before you know it, they'll get used to it. I remember there was a time when we were struggling. Oh, some nurses don't know how to use computer. Oh, and people were really agitating about this, not being able to use computer. But I think nowadays, today, that should be a thing of the past, because there is no nurse that doesn't have a telephone, a mobile phone, which is a mini computer. And you have many that have tablets, that have iPads, and they are using it. And that is the way to go. So Nursing and Midwifery Council really need to work on that. Just like I said, they need to make the continued nursing education, as a recognized learning method that could enhance staff knowledge and skills. They should make it virtual. There should be close monitoring and supervision of e-learning courses that are available online for validation and reflected in the educational and performance records of nurses. They should just look at all these platforms and see which ones are okay, which ones, looking at the content, the presentation, the outcome, learner outcomes and all those things, which ones do we think are good for our nurses? Then send it out to people to go and, attempt all these things. And based on that, they should be able to validate their licenses. Then they need to promote the conduct of additional studies on e-learning and the obstacles hindering the effectiveness, including in-depth study on e-learning methods and their effect on nursing staff performance. And there is just the need to do studies. But if we don't, embrace e-learning, we won't see the need for these studies. And if we don't carry out these studies, we won't see where we need to make room for improvement in our nursing practice and education in Nigeria. So
thank you.
Council really has a lot to do there.
Thank you very much. Thank you very much. I think it's as if we should not stop and we should continue because thank you very much for that beautiful answer there, and you really hit straight to the point, and it was very clear. Now I would like to appreciate my viewers for coming up on the show at this time, and I want to believe that my guest has been able to do justice to the topic because she's professional, and then from experience and things like that, we can see that she's actually telling us exactly what we expected to learn from this topic, and it's all about information sharing, and then to assist one another to accept the fact that things are changing and we need to move with the time as well. Your final word, ma'am.
Yeah. My final word or my final words.
For this particular show, because we are still coming up on the show.
All right. Yeah, I will still repeat something that I said earlier, that gone are those days when we say that's how we used to do it. Gone are those days when you say, now it's time, student, now it's time for lecture. Can you please put away your phone? What the world is saying nowadays is, student, bring out your phone and let us see how we can use that phone to really create a learning opportunity. So virtual teaching and learning engagement cannot replace physical human interaction. However, virtual learning can and does provide a differentiated educational experience and advance the educational mission to educate, empower, and embolden learners and nurses for excellence. So, because of all this, we need to embrace e-learning and virtual learning in nursing education and practice, because that's the way to go.
Thank you very much. Thank you very well. We need to embrace virtual learning and e-learning in nursing education and practice, because that is the way to go. Thank you very much for coming up on the show. My guest is Dr. Odewusi Temitayo. She is, a seasoned professional educator at one prestigious universities in United Kingdom. Thank you very much for sharing with us from your words of experience. And to all my viewers, thank you very much for keeping date with us at this hour. And don't forget, for those ones that are not, are unable to watch now, there is no problem. You can actually access this video on the YouTube channel. You can have all the information. Everything is going to be found there, and you can access it for review and for, if you want to listen to this particular interview again for further, you want to learn more. And don't forget to open the notification bell and subscribe to the channel. Doctor, thank you very much for coming up on the show.
You're welcome. Thank you for giving me the opportunity.
You're welcome. And to my viewers, thank you very much. Stay blessed and stay cool. Don't forget, we still have the COVID is still around the world. Take care of yourself. Take care of your family. Social distancing. Use of face mask. Avoid unnecessary interaction. And I pray one day we get over it. If you have the opportunity to get the vaccine, kindly accept the vaccine. Thank you very much.